And we were talking before we started this, and we were saying how it's great it's getting into dental school, but it actually needs to almost kind of get a bit earlier, doesn't it? Imagine if you could actually get into mainstream school, where people found that it would be okay to, work on their well-being and their mental health. Because I think there's an issue that quite often it's got a connotation there's something wrong with you, as opposed to you just maintain good mental health, as opposed to there's a mental health issue. And what you just described there, it still sounds like it's perhaps in the issue category, as opposed to it's just a good thing to keep yourself healthy. Is that, you've been a dentist, is it 12 years?
Yes,
now?
yeah. I think it's just over 12 years now.
So does that differ to your experience when you entered the profession?
Actually, you know what? We've been swapping lots of stories, haven't we, Tilly? And it actually, a lot of what Tilly is saying right now really resonates with me and my experience. Like that time, quite a while ago. King's, we both went to King's.
Yeah.
And King's has a culture, I think, I don't know if it's particularly King's or all dental schools, but there was a culture of perhaps some of the teachers would shame you. It was a teaching style. So instead of building you up and that kind of compassionate, kind, loving coach kind of teaching, there were certainly lots of teachers which would bring up, they'd spotlight how much litigation there was, and you don't want to be that person who's getting sued. And these little seeds that are planted do really make a difference when you get older. And you actually, as you graduate and you come into dentistry and you potentially practice defensive dentistry, because you're just so scared, quite frankly, of there being litigation. And so that was an interesting kind of similarity still.
Yeah.
And then just the pressure, the amount of study that dentistry has is crazy. It's so overwhelming. And even the content, I feel like the undergrad curriculum could be changed. I'm sure a lot of people would love that, but certainly having a well-being component. I remember at King's, and it's still the case now, isn't it, that you learn psychology to help a patient, but not clinician well-being. And so there is really big room, and I'm sure that in the next 10 years this will change, because quite frankly the younger generation love this. They don't want a life that is not bringing them meaning, and they want a different kind of career, and that's beautiful. I'd love to see that happen, and so I'm really, really excited to see what the younger generation are going to do and really disrupt this space, because it's needed. And having those tools early on, like you said, Andy, having it at school level. I don't know if you've noticed this, but I'm obsessed with well-being, so I'm constantly
you'd never guess.
So I'm constantly when I go to Waterstones and I go to the reading section, I'm beginning to notice over the years that there's lots of kids books that are psychology based. So you've got books around growth mindset for children, books around mindfulness for kids. And literally schools are teaching, at least some of them, because I've been to some of the conferences for teachers, but they are teaching their kids to have this new relationship with their emotions and thoughts and just become self-aware. And I think that's really, really amazing. And I'm trying to bring elements of that into the book as well. But I'm excited to see the future, because it will be more and more where this is just a very normal, natural topic. Let's delve into this. And just like we go to the gym, we're going to be exercising our mind, which is, really, really exciting.
You said when you were talking earlier that you don't want to do another boring webinar on well-being. The book is far from that. I don't know if people had a chance to flick through it, but it's colourful and it's got stories and there's lots of different elements and it's interactive. Is that really important for you and for people who are going to interact with this book, for it to be something that they use as opposed to read?
Yeah, absolutely. So whenever I'm thinking about a product and I'm thinking of a way to, really get that mission and get that vision across, I really want to create something that's engaging and beautiful and something you want to use. Also, I'm not the best reader. I can't read loads of text. I find that disengaging. And so from a reader perspective, what I've tried to do is have lots of different sections. So there's a section, learn from the movies, where you've got pop culture references, and you can start really practically thinking about these aspects. I've got brain workout activities, so you can journal and start kind of exploring these activities, connect them to your dentistry, and so that absolutely matters. I think the aesthetic does matter. You want something that you're going to pick up and you're going to use and you're going to cherish, and I hope that comes across with the illustrations and the colour. I wanted it to be something that was useful.
But it's also, you've made a big point about it being evidence-based as well, isn't it?
Yes.
It's not just your view. I noticed, I looked through the book, and in chapter 1 alone there's 29 references to different published material. And I guess as clinicians, and it being aimed at clinicians and people who are medically qualified, that evidence is important.
Yeah, absolutely. I think that's really, really crucial. And I think my unique selling point in a way is that everything I do, I don't want it to be anecdotal. I want it to come from the literature. And as dental professionals, we're already doing that. We use the evidence base and we bring that to patient care. Why not do the same thing? And I guess also what's a little bit frustrating is seeing this amazing academic research that just sits there as studies and it's not disseminated into the general population. And so I hope that this can be a bridge where I'm breaking down the tools in a kind of the key takeaways in a way that's accessible, that you can, and connecting them to dentistry so that you can apply that. But yeah, absolutely, having proven tools makes sense. You want to make experiments and you want to figure out what works for you, but you also want to know that there's some way that it might be beneficial to you, right? So I think there is, that's always been my approach when I'm teaching. It needed to be centered on something. And when you look at the wellbeing intervention research for medical and healthcare professionals, the research spotlights psychological interventions, things like cognitive behavioral therapy, things like mindfulness, positive psychology, resilience training. So absolutely, why not bring this to dentistry? And you know what, other professionals are doing this, outside of dentistry. You look at Google, for example, they've got a corporate wellbeing program, which they literally teach happiness as a life skill to help with well-being, but also productivity. So it really makes sense to use those tools. And in terms of the happiness, it's the positive psychology element, which comes from the evidence base. So there's wonderful, exciting research around using gratitude, for example, and embedding this in your culture, and how that can increase your feeling of engagement and happiness, even lower things like depression, which is mad to think something so simple could do that. So yeah, it's exciting to think of engaging ways to bring this. And yeah, absolutely, I think the evidence base matters. And I think that's why people resonate with what I'm doing. When I teach mindfulness, again, it sounds so airy-fairy, how can breathing impact the brain and how can it make a difference? But when I talk about the neuroscience of mindfulness, for example, and talk about neuroplasticity and the ability for the brain to rewire itself and strengthen these neural pathways for increased calm and happiness and grit and resilience, that really, I think, helps for us to really engage and understand it and feel excited about it, that actually we can make a difference and we can structurally change our brain at any age. And I think that's why, people kind of really want to try those things. I think without the evidence base, then you might think it's more of a trend, which, and it might put you off. And it certainly did when I first heard about mindfulness and resilience and positive psychology. But once you delve in, you realise that actually it's there's so much interesting data and it's an emerging field, but there's only going to be more and more of this coming in the future.
But also I think those words, mindfulness, and sometimes they're quite, I find them sometimes quite hard to access. You think, well, how do I kind of get into that, and what's my entry point so that I feel that I'm learning something? But you've also got there's quizzes and little like worksheets and stuff in the book. So for somebody who would be relatively new to it, you feel that there's an entry point. Like there's one bit around labelling emotions, about you write down, and I probably don't reflect on my emotions that much in all reality, and I don't know if I'm unusual, but doing something like that, that's a nice easy segue into understanding more about yourself and how you think. Was that that would have been by design, but am I unusual in that I don't reflect on my emotions much, or is that a fairly common thing that people do?
Yeah, absolutely. I think it's really, really common. I think a lot of us don't really sit with ourselves and work out what's going on with our thoughts or our feelings. We also don't have the emotional literacy to do that. We don't know the words to describe how we're really feeling. And so I hope the book can help you become more self-aware, because that's always as I was saying, the first step into improving well-being. I've got I've got a wheel that has loads of emotions and feelings there, and thoughts that can help you become a bit more descriptive around how you're really feeling. And then again, this comes from also work that's been doing in schools, where they're encouraging kids to start labeling and noticing those thoughts and emotions more. And yeah, certainly having those quizzes and making that process fun and engaging is important. So hopefully that's like a fun way to start exploring this with yourself a bit more.
And I think generally gamification works, doesn't it? I mean, we kind of stay engaged. If it's fun, you're more likely to do it, as opposed to something that you're not particularly interested in. And I guess there's probably some science behind tracking it as well. Because if you were, I don't know, say you were saving for a holiday, you would have a budget. Your bank account would get bigger as you save more money, so you track it. Or if you're on a weight loss program, you would track your weight or your vital signs. I assume that from a well-being point of view, by recording how you feel, you can start to see progress as well.
Yeah, absolutely. So, I mean, it might be that not everyone resonates with that, and that's okay. So there's lots of different kind of activities for you, but in terms of the quizzes, they're actually psychological scales that psychologists, we use them already. So if we want to measure your levels of optimism or resilience or even your burnout, we can do that. And what I wanted to do was to bring that also to dental professionals, so that you can, if you actually are interested, you can check in and then start tracking yourself. I also have a burnout gauge as well, so I thought it'd be really nice with the quizzes that already exist, the scales that exist, to connect them to dentistry. And so I have some of the scales I've kind of adapted to patients. I've got a gauge, so instead of having your usual quiz, which would be a bunch of questions, I've got gauges where you can, I think in a quicker way, work out your burnout levels in the 3 domains of burnout. So that's kind of really fun and engaging, I think. And yeah, it's like really exciting to kind of bring that to dentistry. This is my point, like this is stuff in the academia already, in the research, that's just sitting there. And it's things that therapists are doing. Why not bring those tools and bring them to professionals early on, right? So that we can actually have that more accessible and use that in our everyday. And I think that's really, really important to start exploring if that's something you want to do. And yeah, there's a bunch of different tools that you can experiment and find what's kind of works for you the best, because there isn't a one size fits all, and it's very much about making experiments and seeing kind of what gels and what works for you. Yeah, and really going on that kind of journey.